So happy to be with you here tonight. I've been asked to introduce you to physical activity, to health and fitness for people with intellectual disabilities as a segue into a discussion on the partnership between Special Olympics and APTA, and a conversation with some accomplished athletes, and then a call to action. I'm going to aim to set the stage for you and increase your awareness of fitness promotion among people with intellectual disabilities, both within and outside of Special Olympics, and hopefully generate some excitement among you about this area of work. As PT students and future professionals, you have a solid understanding of function, of health, of human performance, and with that expertise, you're very, very well positioned to meaningfully contribute to the lives of many people, including those with intellectual disabilities. So you have an opportunity. To frame this presentation, I'd like to share my background with you and my path to the opportunities that have been presented to me along the way. My undergraduate degree was in physical education, and then I pursued a master's degree in kinesiology. At that point, I wondered where to go, and I decided to pursue a doctorate in adapted physical activity at Oregon State University. I'd had a class in my undergraduate degree in adapted physical education, and I'd had some practical experience that I'd found appealing. And I was also an athlete, so I saw sport and exercise as a very viable medium for promoting inclusion and quality of life among people with disabilities. So my research and teaching now focuses on understanding the unique needs of people with intellectual disabilities and finding ways to adapt, accommodate, and support them in physical activity to improve fitness and physical literacy outcomes. My role in Special Olympics is to work with the fitness team in efforts to engage athletes, coaches, and families in fitness. So I've worked in higher education and most recently with Special Olympics to be part of a solution. I've been given an opportunity to use my knowledge and expertise to make a difference. Now you too have that same opportunity. Special Olympics has a long history of being part of the solution and has been extremely impactful globally in breaking down barriers for people with intellectual disabilities, for really successfully highlighting ability over disability, for emphasizing similarities over differences, for changing attitudes, expectations, and quite frankly, making the world a better place for all of us. So you've heard me mention solution and being part of the solution. And today I encourage you to be part of that solution. But what that means is that there must be a problem, right? And there is a problem. There is. The one I'm going to focus on today briefly is that the disparities that exist for people with intellectual disabilities in terms of fitness and health. And honestly, just not enough physical activity. But I'm going to discuss this problem a little more in a moment, but I'm also not here to present a bleak picture. I'm not the bearer of bad news. It's Friday afternoon after all. So I'm here to direct your attention to the potential that you all hold for making an impact, for using exercise and sport as a medium for the greater good, for improving the health and function of all people. So let's begin with some good news and some positive images around fitness and health among people with intellectual disabilities. So those are just some very brief examples of some of the work that I've done, community-based programming for youth in these cases with intellectual disabilities and physical activity. You'll also see some images throughout my presentation of athletes with intellectual disabilities, So with the opportunity that you're presented with, you can be involved in some impactful work like this. So you can see for yourself that people with intellectual disabilities are perfectly able and willing to engage in physical activity, in exercise, and sport. Research supports this fact, as does evidence from school and community programming. However, there's some pretty convincing evidence, pretty convincing research out there to show that people with intellectual disabilities are, in general, physically inactive. And what I mean by that is that they, in general, do not meet the physical activity guidelines of 60 minutes per day for children and 150 minutes per week for adults. So some examples of evidence are presented here. A review in 2016 of adults with intellectual disabilities reported that on average, only 9% of adults with intellectual disabilities actually met the physical activity guidelines. Another study of objectively monitored physical activity in adults found only almost 11% of adults with ID meeting the guidelines. Almost 87% of adults did not meet the guidelines in a study in 2015. And then if you look at the children and youth literature, Enerson, who was a researcher out of Iceland, found that 0% of the children in his study with intellectual disabilities met the physical activity guidelines. Some work that we did using accelerometry only found about 6% of adolescents with intellectual disabilities met the guidelines. Some more positive work coming out of Europe. In one study out of the UK found almost 24% of children met the guidelines, and a bit of an outlier here, 43% of youth with Down syndrome meeting the guidelines in a study out of Spain. But the fact of the matter is that we do have a problem. And if you look at some of the comparative studies, some of the first three of these here are review papers, but that have tried to examine if adults or children with intellectual disabilities are more active, less active, or equally active as their peers without intellectual disabilities. And you can see here that in general, these larger review papers found that adults and children were less active than their peers without an intellectual disability. And then the objectively monitored studies, again, our work and the work by Enerson showed again that young people with intellectual disabilities were significantly less active than their peers. So the question becomes like, why do we have these gaps in physical activity and how can we close them? We see similar disparities in health. We see similar disparities in fitness among people with intellectual disabilities and people without. And the question is why? Is it that people with intellectual disabilities cannot, should not, will not engage in physical activity? Is it that the condition of intellectual disability itself predisposes a person to low fitness or poor health? Is it that people with intellectual disabilities are unhealthy just by nature of the condition? No, the answer to those questions are no. But let's quickly review what ID is, or intellectual disability is, so that we can better understand what's going on. So the American Association on Intellectual and Developmental Disability defines intellectual disability using 3 criteria. One is that an individual must have a limitation in intellectual functioning or sub-average intellectual functioning, which is typically measured with IQ score. So an IQ of essentially 75 or below puts someone in the classification or the criteria of having low intellectual functioning. Additionally, a person must have limitations in at least 2 of the adaptive behavior or the adaptive skill areas. And what I mean by that is limitations in practical, social, and conceptual skills that are used on a day-to-day basis. This could be things like self-care, time, money, transportation, occupational skills, self-direction, those skills and behaviors that we use on a day-to-day basis. Additionally, the condition must originate during the developmental period, which is before the age of 18. And this condition is lifelong. It persists lifelong. So in order to have this diagnosis, someone must meet all 3 of these criteria. So I suppose if a person is not familiar with intellectual disability and has limited or no experience working with people with intellectual disabilities or interacting with people with intellectual disabilities, then they may make some assumptions about their abilities and their health. They might assume that someone with these limitations in intellectual functioning and adaptive behaviors may be unable to engage in vigorous intensity physical activity or competitive sport. They might find themselves focusing more on the than the ability in the disability. So they might not know that people with intellectual disabilities comprise a very, very heterogeneous segment of the population, that people with disabilities have a variety of support needs, and that with creativity and flexibility, those needs can be met and obstacles can be overcome. What we do know with certainty, though, is that it is not the condition or diagnosis of intellectual disability that's the root of these disparities in health and fitness, but that it's the programmatic and contextual obstacles that restrict participation in physical activity that are the real culprits of these disparities. So it's really important that we move away from our assumptions about what people with disabilities can't do and start to increase expectations of ourselves and of people with intellectual disabilities. And Special Olympics has really been in this business for a very long time. So to better understand these gaps, I've turned to the published literature on the correlates of physical activity among people with intellectual disabilities. And you can see some of the commonly reported barriers to participation in physical activity that people with intellectual disabilities face. So limited opportunities themselves, limited opportunities to participate can restrict participation. Lack of knowledge of opportunities that might exist. Some of the social, intellectual, communication, or motor deficits that are associated with intellectual disabilities can restrict access. It may be that someone with an intellectual disability does not value physical activity, does not see it as important, or may perceive that there are a lot of risks to participation. Those can certainly serve as barriers. In some cases, people with intellectual disabilities have a need for additional supervision or specialized instruction in physical activity or sport or exercise that might not be available. There may be some limitations in professional competency, meaning that service providers, professionals are not well trained and don't know how to include someone with successfully include someone with an intellectual disability in a program. People with intellectual disabilities also report limited social support, low self-efficacy, and motivation to participate. And this is just some. So these are certainly significant barriers, but they're not insurmountable. And many can be addressed through good instruction, through proper training and adaptations and accommodations, the kinds of strategies that physical therapy students are well prepared for. So we have to ask ourselves, we consider these factors and we ask, okay, should we take this as a challenge or give up because meaningful participation in exercise and sport is an impossibility for people with intellectual disabilities? So I told you which path I went for. I went for the challenge and not the impossibility. And the fact of the matter is that there's a lot of support. We know well that people with intellectual disabilities can and will engage in physical activity at a sufficient intensity and frequency to increase fitness outcomes. We also know that with intentional efforts and adequate support, persons with ID can engage in physical activity in a variety of contexts and settings. So we want to take these on as challenges as opposed to impossibilities. So at Special Olympics, we've been working hard to make fitness a key component of our work and to infuse it in all of our strategies. I'd like to just show you a little bit about how we value fitness and the type of work that we do. So our fitness team really aims to increase awareness both internally within our organization and externally about the importance of fitness for people with intellectual disabilities. We really want people to value fitness in all that we do. So we promote fitness for lots of reasons, and we understand its value for improving sport performance. So we know that increased endurance and speed and power improves athlete sport performance. We know that, increased energy and improved focus comes from fitness. Certainly we see that higher levels of fitness reduces the risk for chronic disease and illness. It promotes a healthier weight. So it's important for health. We know that fitness is important for reducing the risk of sport-related injuries. And probably most importantly, fitness is a really meaningful way to promote inclusion, that fitness activities and programming can facilitate socialization and friendships and then it can offer opportunities to level the playing field. We have within Special Olympics 3 endorsed fitness models that are used by our programs, in our local communities and around the world. These are not the only fitness programs that are going on. There's a lot of different programs, but these are models that were created by Special Olympics that we really endorse and we push within our programs, or promote, not push within our programs. One of them is called Fit Families and Friends, which is a 6-week challenge for people with intellectual disabilities and their families and friends to be active and healthy together. Another one of our models is called SOFIT, which is an 8-week program focused on social, emotional, physical, and nutritional wellness for people with and without intellectual disabilities. And then Unified Fitness Club is a year-round programming offering mainly walking clubs, but it can be other forms of physical activity for people with and without intellectual disabilities. All of our models really include families and friends without intellectual disabilities. They're meant to be inclusive. They include goal setting and physical activity, so really rooted in important behavior change modeling. Within our fitness team, we also promote coach education, training for fitness professionals who are out there to try to, better equip them and build their capacity to include people with intellectual disabilities in ongoing programming. We have lots of resources that we've created for within the organization and outside of the organization, including, fitness assessment as one example, opportunities for, we have a manual and opportunities for that, and then a very, very robust fitness in schools program. So I'll finish here, finish up and really ask you this, is what roles can you play now and in the future? I hope you'll take this opportunity, you'll hear more after I'm done here, to consider putting some bricks in the bridge so that there's less of a gap experienced by people with intellectual disabilities. Your roles may be within Special Olympics or outside of Special Olympics, in your communities, in your professional lives. Some ways that you might contribute broadly are, through education, and that may be educating other professionals. It may be educating people with disabilities. It may be educating families around the importance of health and fitness for all people. You may serve as a resource, as a person to go to who has information to direct people with intellectual disabilities in the right place. Where to go for inclusive programming, where to go for accessible programming, and serve as a resource that way. You may find yourself as an advocate, tied in a little bit to education, but advocating for inclusion and inclusive programming, that's successful and meaningful for people of all abilities in your community or in your professional lives. You may find yourself as direct providers, so participating in screenings, through our Healthy Athletes programming. You may find yourself actually being a fitness programmer, running programs to improve fitness and sport, or as a coach. You may also end up as a supporter or a spectator of some of our game events and competitions. So I hope that you'll consider playing a role, even if it's an indirect role. So where we go from here at Special Olympics, we certainly are going to continue our work in inclusive fitness across a variety of settings and contexts. We're going to move forward with training providers and building capacity while challenging assumptions and increasing expectations. So I'm going to lead you into the next piece of this presentation and introduce Donna Bainbridge, who's going to speak more specifically about the partnership between APTA and Special Olympics. Thank you very much. And I will stop sharing.
Thank you, Heidi. Is everyone seeing my screen?
Yes.
Okay, let me say good evening to everyone. We appreciate your attendance at our meeting. I'm going to talk to you about Special Olympics inclusive health and how it's relating specifically to APTA, but also how physiotherapists are involved in Special Olympics health. Let me tell you just a little bit about myself first. I've been a physical therapist for many, many years. focusing mainly on orthopedics and fitness across the lifespan and in persons with and without disability. When I was director of practice at APTA from 99 to 2002, I co-founded with Vicki Tilley, who will speak to you later, the Fun Fitness program. And I have been a global clinical advisor for Special Olympics since 2001. I also am a adjunct clinical instructor at the University of Montana in the minors for gerontology and global health. So that tells you a little bit about me, and I'm going to talk now about our relationship. So Special Olympics Inclusive Health, what is it? It is the goal to create a world so that people with intellectual disability have every opportunity to be healthy. This not only means access to health services and quality health services, but also opportunities for education, employment, sports involvement, and any other pathways that they would choose to actually have full participation in society. One of the parts of Special Olympics Inclusive Health is healthy athletes. And the goal of the Healthy Athletes program in specific is to help improve every athlete's ability to train and compete in sports, but also in life activities. Our really objectives for this program are to improve athlete health, to improve healthcare for athletes, to improve access to healthcare for athletes, to train healthcare professionals so that they are well equipped to work with people with intellectual disabilities, and to be advocates for both improved and equitable health. Our Healthy Athlete program at this point has 8 different screenings. And these screenings are all free. They screen and provide education at both Special Olympics Games and sometimes at events that we call health fairs or health days. We have healthcare professionals who are trained as clinical directors for each of these disciplines in states and countries around the world, and they host the screening. They get volunteers to come to the screening and do the screenings. We used to do the training of these clinical directors in actuality, but now we've switched to online training and a mentored hands-on experience. So it's become a lot easier for us to train clinical directors. We have for each of these events standardized screening protocols and data forms that we use, and therefore the data is stabilized and we enter it into a global database that we use for a multitude of purposes. So you can see that we started in '91 with Opening Eyes, a vision screening, added Special Smiles, which is a dental and oral health screening. Fun Fitness came on board in '99, followed by Healthy Hearing, which is audiology screening, Health Promotion, which does bone mineral density and BMI, but also educates about healthy eating, tobacco cessation, hand washing, etc. Fit Feet, which is a podiatric screening, MedFest, which is a sports physical, and Strong Minds, which is an event that helps reduce stress, teach how to reduce stress and maintain strength. Special Olympics and APTA have long partnered together. We actually began our association in 1999 when I was actually at APTA at that time, and Special Olympics had a meeting and asked if any of the associations there would like to be involved with this new initiative. And APTA said yes, and we have been associated with Special Olympics since that time. We developed in '99 and 2000 Fun Fitness event. I'm a co-founder of that with Vicki Tilley, who will speak to you later. Fun Fitness was developed to be a physical therapy event that really addresses the ongoing health needs of athletes in terms of fitness. So we assess flexibility, functional strength, balance, and aerobic fitness. We then teach exercises to athletes and their families in identified areas of need. We educate participants, families, and coaches about the importance of each of these areas in overall fitness. And it gives everyone a hands-on opportunity to work with a physical therapist and learn how a PT can help them in their quest to become fit. Our overall goal in Fun Fitness is to not only improve their performance so they can optimally perform, but also to reduce their risk of injury. So that you can see the impact of Fun Fitness, in 2018 and 19, we did over 33,000 Fun Fitness screenings globally in 157 countries around the world. There were 317 global events to do these screenings. Our results from many years of experience show that 68% of the athletes have flexibility issues, 54 strength issues, 67 balance issues, and 11% have a history of falls. So that we have developed significant issues in these athletes. In the period of 18 and 19, we had almost 4,000 student volunteers and 1,300 professional volunteers. So you can see, students, that we really welcome you with open arms at our screenings, and we really depend on you significantly to help us with our screenings. So we have trained people worldwide to organize these screenings. We are in all of the 7 Special Olympics regions around the world, 50 states in the US, 9 provinces in Canada, 6 islands in the Caribbean, and 65 countries outside of the US. But in addition to doing screenings, we use the data. We use it for education. We use it for advocacy to try to encourage policy change, and we use it for research. We do have a research tab on the Special Olympics website, which I'll direct you to later so that you can see the kinds of research that have been done. We have also been providing input into a program called Healthy Young Athletes, which is a program for athletes between the ages of 2 and 7, because athletes cannot start competing until they're 8. And then we're beginning to develop programs for our aging athletes, because you can remain an athlete for as long as you choose, but many aging athletes either need different programs or they choose not to compete. So we're developing different types of programming there. We have also tried to develop partnerships with healthcare systems, practices, academic settings, so that we can foster better referral services and follow-up for athletes if they need it. Just a bit more specific on the relationship with APTA. APTA and Special Olympics International actually have an official memorandum of understanding together to work around issues directed to people with ID. Vicki Tilley, who was in the House and is now on the board, developed and guided the APTA position statement supporting the designation of people with ID as a medically underserved population under federal programs so that we can get more provision of services for them. We've also been recognized as a service partner for the upcoming centennial celebration, and the Student Assembly, to which we're speaking, has adopted us as a service initiative for many of their national conferences. But we also have a world presence. I've been involved with WCPT, which is now called World Physiotherapy, for many years, since 2009. And in 2011, we developed a network for intellectual and developmental disability within WCPT, so that those interested around the globe in that topic can be members of our network. We, in 2017, were honored to hold the first ever discussion on issues with intellectual disability at a WCPT conference. So we have actually become the cornerstone for that topic in WCPT. I'm also on the steering committee for the Health Promotion Network at WCPT, representing disability. And we are now working with them on developing a media and working collaboration. Special Olympics and Fun Fitness collaborate on a number of other fitness issues within Special Olympics. We, as Heidi mentioned, work together on fitness and health programming. We're working on health education stations for athletes at events. and we're working on developing caregiver, athlete, and professional training programs. We try to develop cross messaging between fitness and fun fitness so that we're all giving the athletes and families a similar message so that they really understand it and don't get confused with alternative messaging. So our goal ultimately with all of this is inclusive health and fitness. So now I would like to introduce you to Vicki Tilley, who will introduce herself and work with our wonderful panel of athletes on some questions that we've asked them to address. And then we encourage you to put questions that you may have for the panel into the question and answer section, and we will get to as many of those as we can. Vicki?
Good evening, everyone. How are you? Donna, we can take the slide share. I'm Vicki Tilley, and it's great to be here with everyone, and I really appreciate everybody being here. And now it's a great time for our panel to light themselves up. Go ahead and turn on those cameras. I'm going to do a quick introduction of myself, and then I'm going to introduce each of our panelists this evening for some Q&A that we would like to do with everyone. So first of all, my name is Vicki Tilley, and I'm a physical therapist. I'm a graduate of the University of Delaware, and I'm also a geriatric clinical specialist. I've got a private practice in North Carolina and focus on working with older adults. And I've also been a global clinical advisor with Donna Bainbridge with Special Olympics since about 2002. So I've been working with Special Olympics since 1999, but as a global advisor since 2002. Also, as Donna mentioned, I'm recently been elected to APTA Board of Directors, so I'm really excited to be doing that as well. I have a panel of wonderful athletes with me today to go over some questions. So I want to quickly introduce them. And I think Kisha is the one we still need her camera turned on, but I know she's here. But I'll start, and I'm going to introduce first Stephanie Ching. Stephanie Ching is an athlete from Special Olympics, Northern California, and she has been a health messenger for 2 years. She participates in swimming, basketball, floor hockey, bowling, softball, and bocce. Currently, Stephanie is participating in the virtual fall fitness programming. Our second panelist is Colby Gott, and Colby is a Special Olympic health messenger from Maine. Colby has been a health messenger since August of 2020 and has been a Special Olympics athlete for 9 years. Colby's favorite sports are swimming and alpine ski racing. He also enjoys bike riding, water skiing, rock climbing, and surfing. All right, so then our next panelist is Eric Massey. And Eric is a 16-year-old athlete from Special Olympics in Greater Memphis, Tennessee. He's a gold medal winner, a swimmer, whose favorite stroke is the best breaststroke. You're a gold medal winner too, aren't you, Eric? His favorite race is the 100-meter individual medley. He became a health messenger in September of 2020, and he is particularly interested in fitness. And then our last panelist, and I think we're trying to help Kisha to get her camera turned on. Kisha, are you with us?
I can't turn my camera. It's disabled.
It's disabled. Okay, but we can hear you.
The host has to turn out. Okay.
We can definitely hear you. Oh,
okay,
there you go.
see me now. Okay.
We can see you now. That's great.
Okay.
Okay, so Kisha Morgan is 44 years old and lives in Brandon, Mississippi. She has been an athlete with Special Olympics Mississippi since 2013 and became a health messenger in 2017. She currently participates in basketball, track, the 100-meter run, and 4x100 relay, bowling, equestrian, and softball. So I want to have a big welcome to our panel and thank you guys all for joining us on a Friday evening. The physical therapy and physical therapy assistant students that are also joining us, I really appreciate that you're here. And what we're going to do is we have 4 questions that we have sent the panel so that they have some thoughts that they have prepared to talk with us about today. And then we hopefully have the ability to take a few questions from you, from the students that you may have sent to us or post in the question and answer box below. And so we're going to do this for until around 4:05 or so. So I'm going to start, and Eric, is it okay if I start off with you?
Yes.
Great. Okay, so Eric, why is fitness important to you?
Fitness is a way we keep our bodies healthy and strong. It's a way to stay active, and I enjoy it. I like doing different types of workouts. Strength workouts like push-ups and sit-ups. Endurance workouts like running, bike riding, and swimming. I also like kickboxing.
Oh, cool. That's great. All right, thank you, Eric. Stephanie, how about you? Why is fitness important to you?
Fitness is important to me because I want to have a healthy body and mind. I want to eat healthy food, do exercise. I want to be fit to feel strong and confident so that I can live a long and a healthy life.
That's very important. Thank you, Stephanie. That's great. So, Colby, why is fitness important to you?
Fitness to me, I think is important because, well, if you mean physical fitness, well, obviously it keeps my body active, which keeps it healthy. And I also like the adrenaline when my body's moving. Makes me feel very happy for a very long time. And it also helps me feel prepared for any upcoming sports competitions I may have. I like to feel prepared. Mental fitness is important to me, I think, because, see, I'm someone that struggles with a lot of anxiety. I worry about things and can become easily bothered, so exercising helps take my mind off of some of that stuff. So does this program I do in the evening times called mindfulness. Helps relax my mind. Thank you for the question.
And thank you, Eric, Colby. That's great. And fitness is very important in helping us with managing stress. Kisha, why is fitness important to you?
Fitness important to me is because I am fitness, physical fitness. It helps me keep my body moving and this keep me going. And mental fitness is to make you calm your mind.
Calm your mind. That is great. Thank you, Kisha.
You're welcome.
Okay, so let's go on to our second question. And Stephanie, I'm going to start with you this time.
Okay.
Okay. So what does inclusive health mean to you?
Inclusive health means that the same health programs and services are available to both people with and without intellectual disabilities.
Yep, that's great. Thank you. And Colby, what does inclusive health mean to you?
Inclusive health to me means that even though I do have a disability, I still have the same opportunities to participate in sports, just like everyone else in this world. As you've heard, I have done many sports and been successful. And I don't think inclusive health is just about sports. I also think it means that I still have the same opportunities to go see the doctor, just like everyone else. Get healthcare that I can understand. Speaking of which, last week I had to go down to the tent to get COVID swabbed because I had a runny nose and sore throat. I told the nurse I had autism and anxiety. The nurse gave me some breathing tips and explained to me about where the swab was going to go and about how long it was going to take. Came out negative, which was really good. I was proud of myself. I actually went to go do it. Thank you for the question.
Thank you. And that sounds like the nurse was really good as far as explaining things to you, which really helps you. Great. Okay, Kisha, what does inclusive health mean to you?
Inclusive health, it includes everybody who's with disability be included with everything in this world we need to be, including get help providers which will help you understand what's going on with our bodies.
So just to make sure we get your message right, it's that health providers are talking with you to help you understand what's going on with your bodies.
Yes.
Great. Thank you. And Eric, what does inclusive health mean to you?
Inclusive health means everyone should have a chance to participate in healthy activities. No one should be left out, and we should work together to help everyone understand that. Everyone should be able to talk about what their health needs are. So we should teach about self-advocacy, which means speaking up for yourself.
That is very important. Thank you, Eric. All right. So our next question is, what do you wish your healthcare providers, what do you want, I'm sorry, your healthcare providers to know about people with intellectual disabilities? So Colby, can we start with you?
One of the biggest things I'd like medical professionals to know is not to limit or underestimate somebody just because they have a disability. I'm a good example. I'm part of a very inclusive swim team and strength training gym. I'd like to be included in my own healthcare just as well. Thank you for the question.
And thank you. All right. Stephanie, how about you?
I like healthcare providers to know that people with intellectual disabilities may not express their needs and may not understand their symptoms to speak out for themselves. I like healthcare providers to be patient, talk to me, feel uncomfortable to ask me how I feel.
All right, those are excellent points. And Kisha, what would you like your healthcare providers to know?
I would like them to know to help us to understand what we need for this stay healthy and then we could keep going and live a long life, and to sit down and explain what different symptoms we have and this let us know what's going on with our bodies.
Okay. And to talk to you.
Yes.
Very good. Okay. And Eric, what would you like your healthcare providers to know?
I want them to know that people with ID can talk about how they feel, what they like, and about what they want to do. People with ID can follow the directions, so doctors should tell them what they need to do to stay healthy. They could write it at home or get on a chart with pictures to help.
It's very true. That's a great idea. Okay, so you guys are doing great so far. Thanks so much. We have one more question that we sent around early, and then we do have a couple of questions that have come in from the students that they're interested in hearing your ideas and thoughts about. So for the last question, and Kisha, we'll start with you if that's okay.
Sure.
Great. If you had physical therapy, how has it helped you?
It helps my body because I'm have mostly weakness, and it helped my body to get stronger, and it helped me, and would help me to learn how to do my exercise correctly.
And if I'm correct, you had physical therapy for your knee, right?
Yes.
Yes. Okay. And you're trying to keep it from having to have surgery, right?
Now, I had physical therapy, but I keep had to strengthen it.
Right. Okay. Great. Thank you. Eric, if you had PT, how has it helped you?
Well, my mom said I had physical therapy when I was a baby. My arms stronger for crawling. I don't remember that, but I think it worked because now my arms are strong enough to swim all 4 comparable swim strokes. That's freestyle, backstroke, breaststroke, and butterfly.
Great. That's great. Okay. And Stephanie, if you've had PT, how has it helped you?
I had physical therapy a few years ago on my knee. The therapist showed me some exercises to do at home and checked my shoes. I followed and did the exercise at home like the therapist asked me to do. I don't have any more pain. Now I swim a lot and don't have any problems. I travel a lot and I can walk the miles and no problems.
That is great. Thank you. And you can tell that we did have a little practice earlier this week, and you can tell that me, the moderator, confused a couple of people. And so Stephanie, we're physical therapy and your exercise you're trying to keep from having knee surgery.
Right.
Right. So that was my confusion. Sorry, Kisha. Okay. And then Colby, how has COVID, if you've had PT, how has it helped you?
I had physical therapy from kindergarten through 3rd grade, and it helped me a lot because before I had it, I was always very cautious on the playground. I was even afraid of there being anyone other than myself on the playground. I didn't think I would ever make it up that rock wall on the playground. Well, however, physical therapy helped me with things such as climbing ladders, the rock wall on the playground, and riding a bike. Then recess was much more fun and interesting because I could actually do what all my other friends did. A few years after I finished having physical therapy, I started going to a place called Maine Bound, where they have a ginormous indoor climbing wall. They had PT students there helping a lot of people with disabilities learn to rock climb, including me. I really liked their help. The funny thing was, when I first went, all 4 of them had to hold me up all at once. And then the more and more I started going, the more and more independent I started becoming with it. Now that I've had physical therapy, there's a lot of things out in this world I can do that I never would have been able to do without it. Even things such as rock climbing over the ocean and doing triathlons. Thank you for the question.
That is great. Thank you. All right. So how's everybody doing so far?
Great.
Thumbs up? Good.
Yep, thumbs up.
You guys are doing great. Okay, so we do have a couple of questions that have that the students are interested in finding out. And so, as I said, when I ask the question, raise your hand to let me know that you want to answer it, okay? So I can make sure I call on you. So one question is, with COVID-19 and having to be indoors a little bit more, what have you been doing to try to stay fit? So hold your hands up so I know if you want to answer the question or not. Okay, so Kisha, will go to you first.
Okay, I do most of my stay fit, which I have a couple apps on my tablet. I keep up with. I do a little jump roping and just try to do a little different exercises like burpees, drop squats, and wherever I can do it with inside.
That's great. You go, girl, on those burpees. I don't like those. Colby, how about you?
Yes, I'd be happy to answer. When COVID-19 first hit, it was so weird because we couldn't go do things out in the world with all my other friends in Special Olympics. We had to quarantine. We had to go from talking in person to Zoom meetings. And using Zoom at first felt so weird. I had no idea what was going on. It took me a while to figure it out. But some of the really cool things I've done since COVID have been running virtual triathlons, doing virtual workouts online instead of in a gym, and having virtual meetings with my swim team through Zoom. Thank you for the question.
All right, thank you. Okay, that's great, Colby. Eric?
So I was doing virtual workouts, virtual fitness club, and I go and swim practice.
Swim practice?
Yes.
Okay.
I also do a kickboxing.
That's great. Okay. Stephanie, did you want to answer the question?
Yes.
Okay.
I do virtual exercise online from Special Olympics, Northern California. I walk with my families 2 to 3 times a week, and I go swimming for once a week.
Oh, that's great. So you guys are staying pretty active, even though you're not able to do it the same way that you did it before COVID. Okay, so I do think we have time for one more round of questions. And so one question that came up is, what is your favorite Special Olympics memory or experience? Okay, so raise your hand if you want to answer so that, okay. Colby, we'll start with you.
My favorite probably would have been the time when my very first swim meet I did with Special Olympics. It was in March of 2013. I was only 9 years old, and I only knew basic strokes such as backstroke and freestyle. I certainly wasn't as fast as I am today, but I still did well for my age, and I think I even won some medals. Everybody was proud of me. Thank you for the question.
You're welcome. That's great. Kisha.
Right. My special time with Special Olympics when I got to run the torch in for the summer
torch?
games.
Which summer games?
I believe the 2018.
Was that Seattle?
No, the state game.
Okay, the state
Yes.
games. Oh, that's great.
Yes.
That's great. Okay, Stephanie, did you want to answer?
I would, yes.
Stephanie and then Eric, okay? So
I have
Stephanie?
I have several favorite memories from Special Olympics. I flew to Los Angeles to compete in gymnastics when I was 10 years old in the California State Summer Games. I went to Pasadena in 2015 to be on the Special Olympics Rose Parade float. I have traveled to Washington, D.C. for Special Olympics to talk to our senators and representatives about how easy it is to support Special Olympics and their programs like Healthy Athletes and Unified Sports. I went to Los Angeles in September in 2019 to film a video with World Wrestling Entertainment superstar Becky Lynch to give us exercise tips so we can stay healthy and fit.
That is all awesome. Great. All right. And Eric.
In 2018, I went to a Tennessee Summer Games. Swim meet. I went to a swim meet and I won 3 gold medals.
Oh, great. Congratulations.
Thanks.
You guys have all been amazing. And I think we're about an end to our panel. I really, again, want to say thank you to everybody for being with us for this 30 minutes. I think the students have really appreciated it. And even though we can't see them and they can't see us, I'm really impressed with every single one of you. You guys are amazing athletes and amazing health messengers. So thank you very much for being here and for helping to spread this message.
Thank you.
All right. So
Thank you.
you're well. Thank you very much. We're going to move to the last part of our presentation, which is a call to action. And a couple of the questions that have been in the Q&A have been, what can we do as future PT professionals to get involved with Special Olympics and with these amazing athletes? So that's what we're going to talk about right now. So I'm going to share my screen. And here we go. Okay. Sorry, guys, just give me a sec. Okay, so a call to action, and as I think you saw, the goals of Special Olympics and a huge opportunity are, number one, physical fitness and being involved with physical fitness activities, being involved with team activities, and just being able to participate in all kinds of opportunities. And as you heard, not only from the sport and competition standpoint, but also in becoming a health messenger, in other leadership and advocacy opportunities within Special Olympics, that the organization helps and trains the athletes to participate in. It's also joy, courage, and sharing. The athletes, through competition, they learn to work as teams. They share the joy of winning competitions, sharing the time together, but also understanding the importance of working together and supporting each other. And then family, friendship, and community. And it's very important, and one of our main goals in working with Special Olympics is to try to strengthen the community that our athletes are in, so that we create a more inclusive environment, and not only through training healthcare providers to be more comfortable in working with individuals with intellectual disabilities, but also trying to open access into the community for them to break down barriers so that they feel more accepted in schools and fitness centers and places where they want to work, and other types of community options for them. So these all provide an opportunity for us to be engaged with the athletes. Okay, so here we go. What I'm going to show you is a video, and some may recognize, this is Dominic Forboni. And Dominic was a very active member of the Student Assembly a couple of years ago, and was very interested in getting the National Student Assembly to partner with Special Olympics and provide some volunteer experiences with students during not only National Student Conclave, but also our APTA Next conference. And so we have a video with Dominic speaking about his experiences in being a volunteer with Special Olympics. So here it is.
So I'm Dominic Forboni. I originally grew up about an hour north of Minneapolis in Princeton, Minnesota, and I've kind of been a Minnesota boy my whole life. Graduated from Mayo Clinic a year ago now, and since I graduated, I've been working in traveling physical therapy. Once I got involved in basketball, then that's when I started seeing these fun fitness screens and fun fitness activities going on. And once I became a PT, it really became more pertinent to me as far as what my profession was going to be. And I learned that the Healthy Athletes program was created to help providers work with people of all intellectual ability. And I started working with Special Olympics and realizing, wow, this helped me work with people across the spectrum of intellectual and physical ability. And once I'm with a team doing that on a weekly basis, I started noticing how my soft skills and how my ability in the clinical setting or in a patient room started advancing. Fun Fitness is part of the Healthy Athletes program that's led usually by physiotherapists or physical therapists, and it helps bring athletes through stations where they're tested in their flexibility, strength, balance, and aerobic capacity. One of my biggest challenges as a coach was, okay, I have one practice one time a week with these athletes. How do I start to encourage consistent activity when they're in their own space. I just wanted to help more people experience what I was experiencing. You will get more out of this than you put in, I promise you. So the ability to grow your soft skills as a provider in bringing the information that you've spent so many years in school, in a formal setting, learning, it brings so much more value to you because you know you're sending that person away with something that's meaningful to them. You point out something to them that's like, hey, this is a barrier that could really help you with your balance or your running or your ability to jump. And Fun Fitness puts those athletes and that staff and the parents in an environment that opens up space for them to ask.
Volunteers, I thank you for doing this, and it's so awesome.
Ever since I've joined Special Olympics, it's been a blast. I've had a fun time of my life.
It's very important to us, and we all want to thank you for volunteering. We appreciate it.
Okay, so as you can see, Dominic is talking about a couple of ways actually in how you can get involved. And so that's what this section is. It's kind of our call to action to give everybody an idea of how they might look at getting involved locally. First of all, we realize right now that COVID has really changed how we're interacting with everybody and what opportunities are available for us to be active out in the community. Same thing has happened with our Special Olympic athletes and our Special Olympic events. So on the healthy athlete side that Donna and I work on, we have been working on virtual opportunities to continue to interact with the athletes. But the one thing that you can do almost immediately is enroll in our Special Olympics online learning portal to learn more about working with individuals with ID and how to communicate with them and other course offerings that have been developed that talk about fitness with individuals with ID and some opportunities. The courses are free. Our link is on the slide, and we will make sure these slides get out to you. And this is something, again, that you can do at any time whenever you feel like you want to start learning more about Special Olympics and what the organization does. Now, if you want to start getting active with Special Olympics in your community, we recommend that you contact the Special Olympics program in your state to find out what kinds of opportunities there are to volunteer. The Fun Fitness screening events, which we can normally talk about, are on hold right now, but we are really hoping that they will start to open up and start to happen hopefully in the spring, but definitely by next fall during the 100 days of service for our centennial celebration. So please stay posted. We will be getting more information on the Centennial website about what is happening with these screening opportunities. But you can contact your Special Olympics program to find out if they're planning any. We also have opportunities for fitness partnerships, and you can go back to your universities, to your academic programs, and talk among your classmates and maybe your faculty members to see if there's the ability to contact a program to see if you can offer to support what fitness programs, the Special Olympics programs are trying to do with our athletes. We are also working on an educational PowerPoint about fitness that we are right now piloting and hope to be able to offer on a larger basis towards the end of this year or the beginning of the next year. So you might be able to contact your local Special Olympics program and just see if the athletes need fitness buddies, some way where you can offer some time, maybe lead a fitness class. Those types of things are possibilities. So the best thing to do is to contact the Special Olympics program in your state. We are, again, they are trying to do virtual programs, virtual fitness programs, and they may say that they could use some support. So those might be current opportunities. You can also ask about program fundraising opportunities, see if you can put together a team for the Polar Plunge. That's going to be happening this winter. So that would be a great class project, is to raise some money and be a team as part of one of the Polar Plunges. Or you could see if they're doing other fundraising drives at this point. Just in general, we want to send out a call to action. We want everybody to learn more about the health disparities and needs for individuals with intellectual disabilities in your community. Seek out opportunities to volunteer and participate in activities with Special Olympics, wherever you are. Try to participate in community-based activities that include individuals with intellectual disabilities, so you get to know and engage with them more on a personal level. When our Fun Fitness screens are back online, then we will get that information out and hope that we get the ability to have students involved with that again. We fully expect that to happen. It's kind of just a matter of when right now. I want to thank everybody for participating today, for listening in. If you have any further questions, please send them to us, because I know we're running out of time. You can get in touch with Donna Bainbridge and myself. Also, please remember to join us this evening at 8:30 for the Special Olympics American Physical Therapy Association dance party. And we're hoping that we'll also have athletes from across the country joining us at that time to do a little dancing. So thank you so much, everybody, and have a great rest of National Student Conclave.